is again my proud privilege to announce the Dr. Namperumalsamy Endowment Lecture. Dr. Namperumalsamy is one of the founding members of Aravind Eye Care System, and currently it's Chairman Emeritus and Professor of Ophthalmology. Started his career at Government Rajaji Eye Hospital, and then he has made one of the biggest institutions of the world today. We have the AIOS Namperumalsamy Endowment Lecture in his name, and this year Dr. Colonel Madan Deshpande is requested to give the endowment lecture. Sir, please. Dr. Madan Deshpande has accredited the conception and development of H.V. Desai Eye Hospital, which was set up in the year 2000. He is the chief architect. He gave the technical advice and the expertise. The hospital has its quality service delivery, education, skill transfer, and it is a research center. He has done a huge amount of capacity building, strategy planning, and quality review of 2 partner hospitals all across the country. Presently mentoring 12 eye hospitals from Gujarat, Andhra Pradesh, MP, Maharashtra for quality, capacity, and strategic planning. He was president of Vision 2020, the Right to Sight India, from July 2011 to June 2014. We have with us today, and we are proud to have Dr. Madan Deshpande give this oration.
Thank you, sir. I'm thankful to AIOS for this great opportunity, and indeed, it is a great to express our gratitude towards our stalwarts and the elders for setting the pace of development. Dr. Namperumalsamy was one of them, and he, along with Nature and other Aravind members, have done the wonders. So much so, the work they have done, it appears that aliens have done this. Talking about this topic of philosophy with science, we thought that it helps to develop the basic sciences and increases social awareness, the newer technology and accurate diagnosis and treatment, because we have to always inquiry, questions, and this causes universal advances in capabilities. Ophthalmic, I thought that the science relates mostly with the practice, what we do that. And either a philosophy evolves with the practice, or we set our practice with the philosophy. Keeping these in mind, I thought that whatever I faced in my life, I would like to put it on modestly, this thing. Early time, when I was after my basic MBBS, I joined army, and I was in field area. I was in both wars. I was in field area in the sense of snowbound area, then this desert during the summer. I was a paratrooper, I did commando. I thought I was far, far away from even, forget about ophthalmology, I was away from medicine itself. I thought I wasted my time, but no. That is the time I got capacity building in me, which was useful to me when later on in my life. During our postgraduate days, those days, everything depended upon one person, that is professor. He would whether pass you or fail you, and it was most of a self-learning. We are seen regularly doing the work, but we are not supposed to express, talk. Then in army, there is a peculiar system. Where whatever degrees you have got, when you go to army, with your degrees to become a specialist, they are referred to a senior advisor. He watches you, observes you for 3 months. And then whether you are practically, skillfully fit or not, he will decide and recommend you. Otherwise, you remain a general duty officer. So I went to Colonel Sehota, Ramanji's father. He was a very hard taskmaster. He gave a hard look at me and he said, "What all you have done? I don't care what fancy degrees you have got. I want to know what you know today." And he asked me to few theory questions. I was fresh. I answered. Then he asked me to his slit lamp. Those days slit lamp was a rarity, I said, "Sir, I've seen one, but I don't know." So he said, "I'll teach you." This man taught us, and I would say that the work was so hard, we never saw sunrise, sunset in our house. We used to work in the ward. And then the seeds of community ophthalmology were with me because I am from a village. So was Namperumalsamy from village. And I forgot to mention that whole Aravind culture is such that they live philosophy, they exude philosophy. Just now, before Dr. Ravi spoke, I remember one incident. I had gone to Arvind for some workshop, and my baggage didn't arrive with me. I had to give a talk in the morning. At 5:30 in the morning, Chairman Arvind knocks my room door with a set of clothes, trouser, pant, whatever, shirt and everything, including minute details of handkerchief. I told Ravi, look, I respect all of you, but today you are in my heart. There's a sort of philosophy culture they live, and everybody of us were doing that. Of course, I had also opportunity to be with Dr. V for some time. He is the one who induced me to start postgraduate program in HVDSI hospital, fellowships. And I remember when I met him 2 days before he passed away, I went to him and he blessed me while going from, taking this, from, I was tying my shoelace. He gave a wry smile, as normally was his style. And he says, Colonel, you can still bend down. I said, sir, I learned a lesson from you. From today, I'll be modest in my life. Now, community eye care, as I tell you, in army, there's no room for that. I went to commandant to take permission. He said, no, there may be infection. I don't want to take a risk. I'm in a promotion zone. So there's no end. So I told him, sir, I'm going ahead. If infection occurs, problem occurs, I'm not taking your permission, you can court-martial me. If something is good, you can come and preside you the spectacles. So that's how it started. And philosophy is selfless work you have to do. You don't, then post-retirement, either I could go to a medical college. I went there and in 8 days I got, disinterested because there's no work there. They just wanted a professor to have postgraduates. Then Dr. V called me. He wanted me to join Madurai. Somehow I lost that opportunity. Anyway, there's another person, great person, visionary Mr. Pandya, who was blind. He called me and asked me to do these 1,000 surgeries in a small setup in a blind woman's hostel where there was one small operation theater. So I said yes and joined him. Those days he used to think big, always used to think big, and he was a great sort of resource mobilizer. Then initially we had only camp approach. We used to do twice or thrice a week surgeries, about 30, 40 surgeries we do, about 2 of us. And like that, we reached, then shifted to new location. And only motivation doesn't help. We have to have, vision, mission described. And we need to have good financial backing because only cataract may give you a pat on the back, but doesn't earn you any respect. We have to develop the specialities. And that is the biggest task. Because forming a core team, and it was a Lagan team. Most of them had joined after their post-graduation from the various medical colleges. And to send them to various institutes, a lot of problems came. I went to send some girls, their parents came to me. Sir, you are sending them for 2 years for training. What happens for marriage? I said, let them go get married. Let them not come back to me. At least let them learn the skills. So with that, we sent them. Of course, all of them, they came back. Of course, Parishit is sitting with me. Initially, he gave a lot of help. Then, what we thought, then growth, we should have, during that time, when professor from IIM Ahmedabad came and talked to me, I was very fanatic about doing free surgeries alone. He said, no, you have to have a mix of both. And that time, I didn't like him. But then I realized that he told me that when money comes, you are growing, money will come to you. With money, thoughts will come to you. And also some compulsions also will come to you. You have to follow that. But accepting all these things, remember, you should not deviate from your mission and vision. So that's very, very important. That's why your past, your money, and your people can influence your growth and development. INGOs are like, I always tell a story. INGOs, when they help, they do your overall development. It's like an old lady, she wanted to invited a king to have food with her. And the king accepted. When king wanted to go there, he found out was there any house there. So there was no house. So they built a house. They built a grocery, they built a furniture. Similarly, when INGO comes in, there's overall development, you have it. So we had a lot of INGO support. With that we developed, and we never say no to any development program. Of course, inventory control is the most important because the philosophy is resource saved is resource gained. And we used to have the monthly maintenance forecast and have a very, very small sort of a store because so that we should not lock our money. Then vendors selection and vendor loyalty we had for a long time, so we can buy it this thing. But most important is the equipments. we have to give ownership to people, because unless we give ownership of the equipment to people, they won't be okay, because nobody is responsible. But multiple users are there. So, but at the same time, we have to be very, very optimized. Education, they say in Vedas, when you want to give education, there is of course, Veda is knowledge. And they say when curiosity is there, athato brahma jidnyasa. Whenever there is a brahma jidnyasa, what should you do? Gache samit pani shrotriya, brahmanishta. They say go to a person who has a knowledge of theory and also have knowledge of practicals. Then only he will be able to teach you. And then when you go there, how should a student behave with a teacher? They say nirlajjo guru sannidho. That means when you are with a guru, never hesitate to ask questions. Learn whatever you can. If you hesitate, you will not learn. You will not have knowledge. And how do you serve him? Not like what we do today. They say pariprashnena sevaya. Go on asking questions. After the question, till such time, time comes when they say gurustu maunam shishyastu chinna samshaya. You make them think. Don't give them sort of a dole. Make them think. And a stage comes whenever you have got a question in mind and look at your guru, he doesn't answer, but answer comes back to you. So this is what research we should have, education we should have. Skill transfer, fellowships, paramedical education, then and ultimately every teacher in the past, I don't know what about present, we have a desire in their mind that I should be defeated by my student. He should become better than me. With that sort of ambition one should teach, and this innovation we should always have, so that in education, in service, in science, so this is very good. Then when you develop your HR, you have to give them opportunities to grow, in-service opportunities, you have to have flexible HR policy. Then in a difficult situation, you find that some of the HR, they create problems for you. They can be dangerous. Contain that problem. Like this is a situation in a minefield, a soldier is going on with a donkey. He can ride the donkey, but donkey can kill him because he can step on a minefield. He cannot let loose that donkey. Similarly, there are some HR, we have to carry them with you so that they don't create problems for you. Development is one thing. You have to think big. This one small poem I got to know, I put it here. If you can't be a pine tree on the top of a hill, be a strong shrub in the valley. Be the best little shrub by the side of a hill. It is not a size that you win or lose, fail. Be the best, whatever you are. Then, of course, vision building and all they came, or sort of a Vision 2020, INGO support, Aravind. We got all those things, learned, made our plan, our vision, mission, strategic plans. Then with the Seva International, we have been mentoring hospitals. So just, when you teach others, you learn. They say, how do you learn? In Vedic sciences, they say, Adhyan, Adhyapanam, Adhyan. You learn, you teach. When you're teaching, you're learning yourself. So when you're doing mentoring, we are learning ourselves and we improved ourselves. Then, I don't talk much, but about you need to have resources, generate, your finance so that you run properly. And NGO hospitals, you should have like this, your earning and spending should be equal at least. The rest you can manage by donations. Then problem comes when you grow. When you grow, a problem comes when there is a sense of complacency comes in. People's expectation become more wages they ask. A plateau stage comes in because there's nothing much interest, there's nothing to do. A routine work becomes. So that is the time you have to be very, very important. They say, Ma Manusara Yuddhacha. Always you are having a ladai, what that war with yourself. War means, you have to have situations. And how do we come, then, expenses increase, your equipment need to have buy one, many. Then all those things cost money, research, education, quality, everything costs money. And your whole mathematics goes heavy. So when that time, I think how do we manage is, you should have strong philosophy, culture, value system of your hospital. And we are having that. Then recognize the genuine need of the people, satisfy that. Then partnership in administration. You have to give them partnership in administration because they need not go on working, alone and secluded. Make them feel, make them a part of administration. What is administration? Not be separate something. Then participation at national level, international level, and professional satisfaction is one. Each and everybody must have it. Then only they stay together. And last is development of spiritual quotient, like our president here had. Then post-COVID, a lot of things have happened now. The cost of basic surgery has increased, which nobody knows, even government doesn't know it. We have to have adequacy with the government that cost of surgery is going to go on increasing day by day. And procedure also, why SICS to people, why not FACO? All those things are going to come, and that is a part of the Vision 2020, and then AIOS has to do that job. Then cost recovery is again becoming difficult because everything is increasing. The HR cost, I think, is going as high as about 55%, to more than that even sometimes. So then need to have, as told, adequacy with the donors also, because donors must know that it costs money to do a particular job. NGOs. Then, of course, the one question started looming in everybody's mind: what happens if similar pandemic or war comes in? We have a system in Army that we have a crisis expansion plan. Whenever there's something goes bad, we need to have crisis, we have expansion plan. Similarly, we should have a crisis management plan of say 30 to 20% reserve, and that can be kept for things like pandemic. I got this sort of a picture when during the flood everything was lost. Look at a smile, what a confidence. He lost everything, but still he believes he can stitch life again. With that spirit, I think we can tackle all pandemics now. And lastly, I perform this Agnihotra where it says, Idanna mama, it is not mine, I am a trustee to it. With this philosophy in mind, I think you can achieve whatever we are. Thank you, sir.